Good morning, it's Christina with the Sisyphean Journal. I'm providing links below to the videos of the 2 deaths that I've already memorialized on the channel, but I wanted to share something new with you every day. So, as I was doing more research into a death, I found an article in the Detroit Free Press, Dangerous Abortion Mills Thrive Here. And I'm going to share just one of the segments of this because it's a big, long article. And I'll provide a link to it below. Okay. Detroit has become a Midwestern center for crowded, dangerous abortion mills, where operators of unsafe and unregulated clinics prey on the needs and anxieties of scared pregnant women. I would say they're preying more on the anxieties than the needs, because I think what women need is help to resolve the problems that are pushing them toward abortion. They need better housing, they need better finances, they need better access to child care and medical care, they need help escaping abusive relationships. There are a lot of things they need, and they wind up getting abortions instead because the abortion lobby is so busy scaring them away from anybody who would provide them with the things they actually need. Okay, back to the article. These clinics, drawing most of their patients from 4 states, operate in Detroit because neither Michigan nor Detroit regulates or inspects abortion clinics. Now, remember, the abortion lobby tells us that it is not necessary for the state to regulate and inspect abortion clinics because the practitioners are above reproach and can absolutely be trusted. It's targeted regulation of abortion providers. Anything you do to try to peek behind the door and see what's going on is anti-choice. Okay. Surrounding states and cities have been licensing clinics for more than a year, meaning they're actually making them go through some kind of process to make sure that they hold up to some kind of standards. Surrounding states and cities have been licensing clinics for more than a year, and the inadequate and sometimes life-threatening conditions in Detroit's clinics would not be permitted in Illinois, Ohio, or Indiana. But again, if the abortion lobby had their way, they'd be permitted everywhere because regulating abortion clinics is targeted regulation of abortion providers. Keep that in mind. When they say trap regulations, they mean regulations that would stop the kind of crap that I'm going to be reading about in this article. This lack of regulation permits a level of medical care so low that at one Detroit clinic, an ex-convict with no formal medical training performs both early pregnancy abortions and more complicated late pregnancy abortions. Ex-convict with no medical training. A woman and her doctor. Don't want to look inside those clinics. No, that would block access. So, a 3-month free press investigation of a dozen Detroit area abortion clinics found few that would even meet the informal guidelines suggested by the Michigan Department of Public Health. Now, something else to keep in mind as I'm reading this, okay? The abortion lobby gets their knickers all in a twist about fake clinics, which is pro-life centers that do horrible things like hand out baby clothes and help women find better housing, help hook them up with social services, make sure that they get proper medical care, all those horrible things that fake clinics do. But these places can pass themselves off as clinics when they're unregulated. Nobody's going in and inspecting them, and that somehow is not a problem. Fixing that problem is trap. Okay. The major findings of the investigation are that 5 of the clinics were prepared to perform an abortion on a free press reporter who was not pregnant. Now, we don't have that problem nearly as much anymore because of the home pregnancy tests, but during the pre-home pregnancy test era, Dr. John Wilkie estimated that probably about 13% of abortions were performed on women who believed themselves to be pregnant but weren't. And if you follow the blog, if you follow this channel, if you've read line 5, doing abortions on women that weren't pregnant is like, well, she's here. We don't want to send her home and not get our money. At least 2 of the clinics kept patients overnight in violation of state laws that prohibit overnight patient stays in places that are not licensed hospitals. 4 of the clinics perform abortions on women who are more than 12 weeks pregnant. Most gynecologists consider late abortions unsafe when done outside a hospital because of the increased danger of infection and hemorrhage. Indiana, Illinois, and the city of Cleveland require that abortions past 12 weeks be done in a hospital. Now, it's not considered any big deal to be doing third trimester abortions outside a hospital. And again, that's something you need to remember. These post-viability abortions that are supposedly done because the woman's life is in danger, they are not being done in hospitals. The woman goes into the facility, they do a lethal injection to kill the baby, they put in these little seaweed sticks to expand her cervix. If she's later into pregnancy, they're going to swap them out a few times, but she spends the bulk of her time in a hotel room. Actually, I think they're better if they're keeping them overnight in the clinic than sending them to a hotel, which they do now. So, of the dozen clinics surveyed, only one appeared to be meeting most of the commonly held medical standards, as we're only worrying about medical standards, because as well as providing adequate counseling and a comfortable atmosphere in a situation with stress and concern for patients. So that's from a newspaper that looked things over. I'm going to pause here. I'm going to go ahead and find some more of the egregious examples of what they found. Okay, since Michigan doesn't require doctors to report abortions, it is impossible to know how many women experience complications from abortions in Detroit clinics. We actually have no idea how frequent abortion complications are. The big study, GIPSA, Joint Program for the Study of Abortion, just asked abortion clinics to send in their own records of complications, which means that it's not going to catch any complications that are noticed after she leaves the clinic. And abortion clinics have been caught filling out the post-op reports before the woman even climbs on the table. The woman at Center for Reproductive and Sexual Health in New York was charted as alert, pink, responsive when she was actually dead. Okay, so one Detroit woman required 12 major operations, including a hysterectomy, following an abortion at a Detroit clinic last year. Another woman bled for 2 months following her abortion this spring and required a second abortion. 2 Cleveland women were hospitalized following abortions in Detroit this year. And here I'm going to give some credit to a pro-choice person. I think you have a complete breakdown of regulations, said Donald Fern, Executive Director of Planned Parenthood of Cleveland, not only by the medical professionals, but by the county prosecutor, the state health department, just a total breakdown. Oh my gosh, they're calling this out. I think it might be because they've got a reporter sitting there with a notebook going, and what do you think of these things that we found? And they're not going to go, oh, for the love of Pete, would you leave it alone? They're going to have to say, oh, this is horrible. Remember, the National Abortion Federation said that about Kermit Gosnell. They're like, oh, he's just horrible. He worked one day a week at one of their clinics. So obviously they didn't think he was that bad. They only thought he was that bad when people from the outside were looking. Before any abortion clinics opened in Cleveland last fall, this is in 1974, so it would have been right after Roe v. Wade when the facilities are springing up. Fern's group referred women to New York and Pennsylvania for abortion. We never referred to clinics in Detroit because of the quality of care. The facilities were totally inadequate. I will actually give them credit for that, because I do know that Planned Parenthood said they stopped referring to Kermit Gosnell. I know National Abortion Federation clinics were still referring to him, and that one in Delaware was just handing patients off to him. So they're saying we didn't refer to them. It'd be interesting to check their books and see if they did or not. If they did actually check to see if they were adequate, that would kind of make them stand out. Detroit's abortion clinics get many of their patients from commercial referral agencies that either charge patients directly or receive illegal kickbacks from the clinic doctors. This is something we've seen in a lot of places. Some of the referral agencies are run directly by the clinics. Most are simply telephone answering services that advertise on billboards, matchbooks, on the radio, in television program guides, newspapers, and the yellow pages, although physician advertising is illegal in Michigan. So they got around that by advertising as a referral service rather than as a facility. Many of the out-of-state women who are attracted to Michigan by advertising come because abortions after 12 weeks are either too expensive or unavailable in hospitals in their home states. In Chicago, a hospital abortion costs $750 to $1,000. One Des Plaines, Illinois woman recently paid $500 for a late abortion at Snowden Medical Clinic in Detroit. The price included $75 paid to the Chicago referral agency, Family Services Counseling, and $425 paid to the clinic. The woman had been told that the small brick building where the operation was performed, which the clinic shares with a dentist's office, was a hospital. It is not. They'd actually been inaccurate if they were even telling her it was a clinic, because it's not. It wasn't licensed and overseen by the state. Ironically, she could have received a safe abortion for only $400 at nearby Detroit Memorial Hospital in downtown Detroit. You'll notice that this place takes her money for referring her. Do you think maybe they were getting a kickback too? Instead of referring her to the hospital. Of course, if she'd gone to a pro-life center, she'd have gotten help with whatever her problems were. The abortion she received at Snowden was not safe. It was performed by Eugene Ralph Mara, 44, an ex-convict who is known at the clinic as Dr. Mike Morrison or Dr. Mike. Mara is not a doctor. Mara spent 5 years at Jackson State Prison from 1954 to 1959 for breaking and entering. He served 1.5 years from 1969 to 1971 for abortion and conspiracy to commit abortion. An erstwhile criminal abortionist working in a safe and legal abortion clinic. Again, I've told you, okay, we're not going to look real close attitude that came with legalization. It didn't seem like it's particularly helpful to women, but it certainly was helpful to Dr. Mike. She said that Mara performed a saline abortion, a procedure considered unsafe even when performed by a licensed physician outside a hospital. It was unsafe when performed by a licensed physician inside a hospital. Japan, Sweden, and the Soviet Union stopped doing saline abortions because they were so risky to the women. A saline abortion performed on women who are more than 15 weeks pregnant involves the injection of a salt solution into the uterus. The salt induces labor and the woman passes the fetus. Or perhaps hemorrhages. So, the Illinois woman said Mara injected the solution by passing the needle through the vaginal canal into the uterus, a route that gynecologists generally avoid because it greatly increases the danger of infection. Instead, most doctors inject the saline through the abdominal wall into the uterus. The woman said she was initially examined by Dr. Joseph Rucker, the clinic director, who is a licensed doctor. But she said the actual abortion was performed by Dr. Mike, who also assisted when she passed the fetus. So we're 13 minutes into it, and that's enough for today. Keep coming back, and I will cover more of this story.